let's talk about some pain psychology techniques that you and I can use to help ourselves out when our depression is overlapping with our chronic pain. Even if you don't have chronic pain, this will be a good chat here in this little blanket fort together. Depressed people are welcome here too. Well, of course, as always, you know I am a physician who's also a mental health patient. I have extensive experience treating people with mental health issues, especially in the military, because I was a sexual assault medical forensic examiner, and specifically, that doesn't necessarily treat mental health issues, but as the sexual assault care provider for my brigade, there's a lot of that primary care, behavioral health work that I was credentialed for, and then also obviously I've taken care of soldiers who have other, comorbid issues like PTSD and other things like that, in addition to their overall health picture, right? However, anything that we talk about today isn't official medical advice, right? And I'm also not your therapist. For that, I would recommend you hit up, I have links in the description for ways that you can get free, care. And then if you can't get free care, or if you need something a little more intensive and online, I have a link down there too that's an affiliate link to help you out get therapy too. I got you a deal on that. So that I always try to provide resources for you when maybe I can't fulfill a role that you need, because I am just a YouTube video. Right. And then, of course, I have the experience as a physician, not just as a physician, but as a patient with severe MDD and fibromyalgia and some other comorbid stuff. Actually, some pretty rare and unusual stuff, which we'll talk about at some point too. But for today, I want to talk about some 4 or 5 different pain psychology techniques that might be fun for you to try. Maybe not fun, but yeah. Before we get started, why don't you just tell me how you're feeling? Yeah, even if I'm, far away and can't, it's in this moment, it's good for you to say things to somebody, right? Whether or not they're, yeah, why don't you get a pen and paper? Yeah, why don't you get a pen and paper and just kind of tell me how you're feeling right now? Did you know, I'm gonna have to find the link to the study now I'm mentioning this, but there was a study that found that, this is so annoying, but there was a study that found that people who journaled regularly who had asthma had a lower incidence of asthma attacks than people who did not. And that's not people who journaled, that's an actual intervention. Like so it wasn't a longitudinal or prospective trial looking back, retrospective trial. It was a clinical, it was like an actual experiment. They had some people do that and some people not. And people who didn't had lower, that's my understanding anyway of the experiment. You might have to read it and check me on that. But all I know is that the study results found that you have a lower incidence of attacks. People had lower incidence of attacks when they journaled, right? But you don't have pen and paper companies out there lobbying physicians. The reason I mention that is because your body and your mind are very connected, right? Your mind releases histamine just like your lungs do, right? Your mind releases it as kind of a form of anxiety. Your lungs release it when they're, going to constrict, and sometimes, depending on them, there are histaminergic asthmatics, and there are asthmatics who are more mediated through other means like bradykinin and other stuff like that. But the point is that the same chemicals are related. And what's interesting is that we know that in mental health, one of the first mental health medications that I would give to my survivors after sexual assault, and it would make such a big difference within the first couple weeks whether they got this or not, was something called Atarax or hydroxyzine. And that's actually originally an antihistaminergic drug. It's just that people found that it wasn't as useful for, clearing up your runny nose and stuff like that as it was for your, it was very, very useful for your anxiety. Do you like this sound? Just kind of dab on your face and dab on here. we can do different sounds. Is that okay if I do that? Go a little backwards. So, the body and the mind, like we know this scientifically, your brain is an organ. So these things are connected to each other. And similarly, actually, the nightmare medication that I take, prazosin, which is, they give it to a lot of soldiers with PTSD and stuff like that. It's also used as a blood pressure medication. It was originally used as a blood pressure medication. In fact, it's just that they found a side effect of it was it got rid of nightmares. Well, part of that, I actually am not sure about the specific neurotransmitter involved in prazosin, but I do know that serotonin mediates both blood pressure and depression. And, so these things are all tied together. I think it's a different neurotransmitter with prazosin, but I'm not sure exactly. But the point being that these things all interact with each other, right? Everything you put in your body has some other effect as well. I hope this is okay and not uncomfortable. Yeah. So, with pain psychology, so if you have chronic pain and you don't have a pain psychologist, it's something you should ask about, especially if you found that your doctors just tend to give you pills. They will be happy in the current opioid crisis to get you to a pain psychologist instead. Pain psychologist is a really wonderful, tool or partner to have in your arsenal. And what they do is, put this on your face. What they do is they get your I like this blue thing, don't you? This is the blue wand of healing. I'm actually not that young. I may seem a little young for my physician years, but actually not anymore. Not now that I've started developing the I want to say mommy chin, but I'm not a mother. But this like, you see the little curve and the curve and the curve. That's very Danish. I'm Danish and Japanese, and on the Danish side, I notice the women start doing this as they get older. Just a little, it's kind of like a funny fat little heart. Yeah, so I look younger because of the Japanese side. I would look a lot older with my stress and my lifestyle, even at my age, then, I would, if I didn't have the Japanese in me. It's like Keanu Reeves and Markiplier and them. They have the same kind of mix that I do. It's different because they have different Asians than my Asians. But, yeah, we're going to look younger for a longer period of time. Alright, some more pain psychology techniques. I haven't even talked about them. So, I was talking to my pain psychologist about this yesterday. Really, the goal of pain psychology is to try to get you into theta waves. What are theta waves? Well, we know that people who are in pain, you can do imaging and see that a large amount of their brain is taken up on pain, especially people who have chronic pain, right? And that's going to be natural over time as you've been having pain for a long time and you've been trying to mitigate it. But, pain signals come from two directions. You have pain signals that come from the peripheral nervous system, right, where the pain is located. And then you have pain signals that come from the center. And those tend to develop over time in response to chronic pain and get worse. And it's kind of like that with any chronic response to distress. Okay. So, one basically major goal of pain psychology is to try to get, and use techniques that work in other areas of depression, to try to get your, kind of retake some of those areas of your brain, so that at least if you can't change the signals coming from down up, you can change the signals coming from up down that make it worse, that potentiate. I have a really good pain psychology workbook that I lent to a patient and never, ever got back. And it's kind of a bummer because it was my workbook and I don't know the name of it. Anyway, I'll break out the one chapter that I have saved that I didn't lose. I'll break that out for you at some point. It's okay, I guess. I was a really good doctor to that person. That's my best patient. My best job I ever did, I think. So, let's get to actual techniques, because you don't want to just sit here with me in this fort listening to my quiet voice and seeing this. You've seen this in a lot of the times we've spent together before. This is the thing I use for my fake tourniquets, because obviously I'm not going to bust out a real tourniquet for a video. They're very expensive. Also, because I don't have any more. I need to order some before my next trip. I'm actually kind of paranoid. Anyway, so pain psychology techniques. So the goal is to try to get your brain, so when you sleep, right, you also have restorative waves, and you start out in alpha and you move on until you get to things like, like your late stage sleep is your delta, and then of course you have your REM and everything else like that. Well, the awake wave of your brain that most closely mimics the restorative brain sleep that you have are called theta waves. If you look them up, you're going to find all kinds of weird, non-scientific stuff about them, about, people's response to, right, like mostly in the kind of meditation field of mental wellness, where a lot of times people will bring in stuff that is pretty religious, and that's fine as long as you're honest about it. Sometimes people aren't honest about it, especially in the ASMR community, and they'll bring in things that are actually more religious than evidence-based. And I try to be honest with you because we all have our own biases. And I often mention spiritual things because we are complete creatures. We have imaginations, and we have a lot of different kinds of neurotransmitters and electricity going on here that's not very well understood. And a lot of abilities, I think, that we either take for granted or don't really unlock when it comes to what's going on here in the brain. And so one of the goals of pain psychology is to kind of unlock one of the abilities of the brain, which is to go into that theta wave state. And anyway, I try to be honest when I'm deviating from, or when I'm saying a thing that is based on an experience or a, studying, ancient spiritual manuscripts versus studying modern, medical studies. Talking with my pain psychologist, talking about like the theta wave goal. That's something that you can check on PubMed and look at that. And people, I highly recommend you check anything I say that sounds a little odd to you. You check it on PubMed.gov. That's the first place where you can go to find studies. Okay, and actual studies, not studies that a reporter has parsed for you and told you what it says, which is not the same thing. Okay, but like studies for yourself. Obviously, it helps to have biostatistics background of some kind. We're required to take biostatistics in medical school, and again in residency, to use that so we can properly evaluate studies, because there are crap studies out there, right? So you also have to know how to evaluate them. You and I did a session together, a video, on evaluating health claims, where I go through and demonstrate how to do that. You should absolutely do that, okay? always check things. Alright, now that I've rambled a lot, let's go through one more thing. So, that's one goal, is to try to get those neurotransmitters, aligned. So the 3 goals of pain psychology, the one that I mentioned. The first one I mentioned was you're trying to get your neurotransmitters to do the things in your body that they should be doing, similar to like how you regulate histamine, serotonin, all those kind of things, by changing some of your brain patterns of your. Second being trying to access the theta wave, restorative sleep wave, even though you're awake. And then the third, did you know that the receptors in your brain that are triggered by morphine, and in your body that are triggered by morphine, they weren't made for morphine, obviously, they were made for a chemical that already exists naturally. Well, that chemical, opium, is a naturally occurring chemical, but you did not co-evolve with opium or whatever it is in order to. So no, when you were created, you were created with these receptors that are called mu receptors, and they are specifically linked to a chemical that your body makes itself. Specifically, enkephalins are one of the most powerful versions of this, but it's your body's own opioids, okay, which are many orders of magnitude stronger than morphine, like tens of thousands of times stronger. And your body actually can release that stuff on its own. So the question is how, and that's why sometimes people who are in like a very severe, like about to die accident, they might not have any pain at that moment, because they might be in such severe, end of life time that the brain has just trauma dumped all of that. And I don't understand anyway, I think most people don't, why sometimes your body releases it and sometimes your body doesn't. But we want to try to take advantage of the fact that your body has these abilities, right? So these are all things that we can try to trigger with your brain. So there are a couple ways that we can try to trigger these like happy, relaxation states, basically, which help with pain, and obviously it's going to help with your emotional pain too if you have a physical sense of well-being, right? So one technique that I have talked about before extensively is distraction. It's one of the things ASMR is very good for. It's not the same as repression or trying to push down the negative emotion or the negative feeling. You're not ignoring it. All you're doing is you are saying, I'm going to deal with that strong emotion later. Right now I'm going to feel a little better. And you distract yourself from the pain or from whatever it is that you're feeling. And if you can get into a good distraction state, that can be very effective. That's why in some of these videos I do other stuff with you, like we look at pottery or other things like that. Maybe we read a book or something like that, and we'll keep doing those things, especially at the end of the videos. Not today. Today I am tired, and tomorrow I'm going to record all of the videos for the next couple weeks like I did with this last big batch. But today I just wanted to get out a video to you because I said I would. I haven't yet. So today we're going to maybe just going to spend some time together talking about this. Next time we might do a little bit of other stuff. I want to try to incorporate other triggers, ASMR type triggers into what we do. Yeah, I'm getting nestled in here in my little nest. So, what was I saying? Okay, so that's one technique. And partly one of the reasons we're talking about this today is I need to review stuff from yesterday going over with my pain psychologist, and I figure we can review together. You help me, I help you, we can work together. of strange, right? It's called color therapy. My previous pain psychologist used to do this with her cancer patients who were really terminally ill and were having a really terrible time. And I brought some stuff we can use for that. Don't tap on paintings. It's ink. This is very, very bad what I'm doing. Also, this was not cheap. This was not a cheap painting. Look at the cool colors. Isn't that neat? So color therapy is not just looking at cool colors. Color therapy is kind of selecting a color that you feel comfort about that triggers that part of your brain out into both, distraction and relaxation. And you find a color that has that kind of affinity towards you, and it's similar. Like they have done studies in architecture, and I'm not an architect, so I don't know about these. These are things that somebody else would have to look into more. They've done studies about how certain colors help stimulate certain behaviors and moods and relaxation states and that's why architects try to incorporate certain design principles, right? Understanding the psychology of the colors and the world around us, right? There's a whole field of that is most prominently used in things like interior design and architecture because people want to make a lot of money there. They want to be using the wiring of your brain to make it happen as well. This is called Superman Deconstructed. I didn't know that. Wow. Oh, that makes me sad. I literally never looked at it. Like, Superman Deconstructed. I don't like that. This picture's not ruined for me. Okay, well, I thought it was a cool galaxy type thing. Now, oh man, Superman got squished. Okay, well, the point is, you look at a color that you find, invigorating or relaxing, that you feel you have an affinity to, and you spend time carrying that color around. Spend time looking at it. You spend time tracing it, and you spend time really getting, I love this blue right here, this one. You spend time really getting into that color, and just kind of looking at it. So, we'll trace, watch this. Green, go all through here, and then out here, and then over here with this green, and then it goes down into this purple. There's purple here. There's a lot of white, and I found this section of white. There's a little silver. So this here looks like kind of like how do we get this to geode? Like here. Oh, can you see this? I don't know if you can see how green it is. Kind of follow that trail. So you gotta really get into it. You have to focus above anything else on the color in the moment until you forget everything else. And you basically kind of put yourself into a trance, and you can do that by tracing it. You can do that by staring at it and moving it back and forth. You can do that by talking yourself through it like I just did. I'm observing the tiny, minute details about it, so it's also good brain training for observational skills. Right? Tracing this black, right? Oh, there's a bump here, the black goes through, there's a little hill there, goes through, goes up, and then up, swirl around. This looks like a flame. Black flame. That sounds like a great book title, doesn't it? So you really focus down and you get into the color, right? And we'll do more of that kind the stuff together. We should do probably a whole video on color therapy at some point. It's a little woo-woo, right? I haven't seen any studies on it. I haven't looked for any studies on it. I tried it when my pain psychologist recommended it to me, my last pain psychologist, and I found it helpful. I hope she's okay, because I haven't heard from her in a while. And I know she had some health problems, so it sucks. Okay, so, distraction of any kind can be good. Pleasurable distraction. Did you know for people who have, so there is a disease, there's a disorder caused by marijuana overuse, where you end up inflaming your stomach, and you get constant, incessant vomiting, and you can't stop vomiting. It's terrible. It's a cyclical vomiting syndrome, and usually we'll look for it, and I've actually treated a lot more of this than I ever thought I would see. But people who would come into the ER or come into hospital with just this constant vomiting, and they'd be a kind of older teenager, younger 20s, and eventually you dig into it, and the big giveaway in this terrible suffering that they're having is that it all goes away with a hot shower. But then they have to be in a hot shower like all the time. They can't not get out of the hot. Well, and that's how we would find it. And then I was very good at getting people to tell me about their drug histories, because unlike everyone else, I wasn't judging them, which is something I got in trouble for also at one point, but whatever. Because my goal is to help you get better. If you're doing something that's unhealthy for you, whether it's an unhealthy sexual behavior or an unhealthy ingestion behavior or whatever it is you're doing, my goal is to help you get better. And I'm looking at it as a disease or a self-harm, not as like, oh, you're bad, blow me and we'll get rid of you or whatever it is. Because I have a lot of not healthy behaviors myself that I'm not, I don't get better from that by people yelling at me or whatever. So I feel like a lot of doctors don't really understand basic psychology, and there's a principle called motivational interviewing that we use, which is to try to get people to do healthy things, and it's like the most basic psychological technique you could ever practice, and most physicians are terrible at it. And just because most physicians are really judgmental. Like, just like, I hate doctors. It's a little judgmental. What was I saying? So anyway, that cyclical vomiting syndrome. It's interesting, right, that it's impacted by a hot shower. Why is that? Well, because hot and cold trigger your blood vessels to vasoconstrict. Hot makes you vasodilate, cold makes you vasoconstrict, depending on the part of your body, right? And this is a hot and cold, the science of heat and cold in the body, or thermodynamics, biothermodynamics, is very important for things like wilderness medicine, which is my other area of skill. Because, for hypothermia, it's important to know, for example, that all the blood vessels in the core have, dilated so that all the blood will come there, and all the peripheral blood vessels have gone into vasoconstriction when you're very, very cold, because they want the blood to go away from there and go into the core. And that's why there are some rewarming techniques that are actually dangerous, because they'll actually cause the blood to circulate back through the outside into those cold extremities, and you can get a heart attack because of that cold shock coming back. Anyways, there's all those techniques there. Well, hot and cold science is also important for people who did, like ancient First Nations or Native American techniques with stones, or people who did, like the ancients who studied things like hot stone massage and stuff like that. Any of that works based on these hot and cold principles of vasoconstriction, vasodilation in the body. And that's kind of the scientific underpinning of why sometimes that stuff works. And that's, I was studying hot stone massage recently, and I'm very excited that there's some, you want to learn about scientific basis for things. You don't want to play nonsense games with people's bodies. evidence that it works, and also the theory behind it. And I'm looking to understand maybe a new theory that isn't so scientific as well. But then I'm not going to use that on somebody without being very, very clear, like, this is how this works, this is how this does work. It's the patient's body. And I don't, we shouldn't play games. We should use things that either we know is going to work or the patient understands the risk and the reward. Right? So anyway, all of that to say, all these little tangents, all that to say, the risk and reward, the benefits, and what's pain psychology, cold and hot. I'm talking about cold and hot. Well, I'm talking about cold and hot because in that cyclical vomiting syndrome, the effect of cold and hot was so stunning on how the blood flow was working in response to the THC and cannabinoids in the person's system. That actually it was a treatment, right? This really happened. The real treatment was to get them off of marijuana, get them a lot of Zofran and promethazine and other anti-nausea medications, get them to keep stuff down, because it could get so bad that they were in danger of dehydrating and dying and things like that. So that was the real treatment. Is like, okay, well, you're someone who you probably can't use this. You shouldn't be, because different bodies, right? So some people's bodies you shouldn't be. You shouldn't. You're either because of overuse or because your body is too sensitive. You should stay away from this thing that makes you very sick. Cyclically vomit. And of course, there you get into the side facets of addiction, makes it so that even though something is making you so miserable, you won't stop, and so forth. So that's we're talking about extreme ends of the use spectrum. Similarly with alcohol, like a lot of people can use alcohol and be just fine, but then you have the end limits of the alcohol spectrum where it's not fine, where it's bad news bears. So that's so hot and cold. So what does this have to do with you in pain psychology? Well, you can use the principles of hot and cold to soothe your body and also soothe your mind. For example, if you have chronic pain, then warmth is often a very good way to deal with that, because you want to stimulate blood flow into the area to break up some of those old chronic adhesions and other things like that. For not so chronic pain, cold, like, that's why we put an ice pack on an injured vessel. You don't want the inflammation to go out of control. You want the appropriate amount of inflammation. Not vessel, but like a swollen joint, right? You want to mitigate the damage. And you want to control the amount of blood going to a place. You want it to different. It's different for chronic versus long-term pain, because the actual I think my brain distracted myself and put me off. The cytokines that are going into the area, you kind of want to control that. And obviously, it's a very imprecise science in cold. So really, what they recommend right now in sports medicine is you put on it what feels good. Well, anyway, that's what they were recommending when I was studying with sports medicine people. So you put on it what feels good. So try hot, try cold, try taking a very warm shower. The Swedish technique where they go, it's not actually Swedish, it's the Nordic technique where you go into a really hot sauna and then go out into a really cold, like icy cold, bad thing, and then afterwards you just feel so alive. Obviously, if you are someone who has a cardiac condition, that could be super dangerous. You got to do you got to be careful within what your physician and you understand and recommend for yourself. But there's something to that, is what I'm saying. There's something to shocking the system and causing certain bradykinin and cytokine neurotransmitter release within the constriction and dilation of your blood vessels. Understand, remember, serotonin is a vasoconstrictor. Serotonin plays a role in your blood vessels closing. Not a vasoconstrictor. Serotonin is a vasodilator. Is that correct? Yes, because it's the opposite one. Serotonin is involved in your blood pressure. And so you're going to get feedback loops because of that, right? Your body releases neurotransmitters and hormones in response to what's going on in the body. So, for example, if you have a cut and you are bleeding, your body will sense that drop in, or that loss at that particular point. Maybe that tissue damage is going to cause your coagulation cascade to go down, and in response, your local blood vessels are supposed to vasoconstrict. They're supposed to go and close up so that you don't bleed out in that little cut. So the chemical that is released is in response to what the blood vessels are already doing, being open or closed, right? So similarly, if you can trigger your blood vessels to be open or closed, the way they need to be, you can trigger these neurotransmitters from your brain. That's so anyway, that's some of the theory behind why hot and cold works, why like a hot bath will help in something like that, cyclical vomiting syndrome. Why it feels good when you get a hot stone massage, and why they have their theories for why they do hot in some places, cold in some places, depending on the chronicity or acuteness of the injury, and why your Swedish or Nordic cold hot sauna works. So basically all of this stuff is working based on these reactive principles in the body, right? And you can hack your own hardware. Basically, you can biohack yourself to your advantage, right? So when you are, very miserable in the middle of the night, you can go and take a big, draw a very, very hot bath. Obviously, don't scald yourself. Put in a chemical or essential oil that you find relaxing, something like lavender, which has actually been studied to promote sleep and rest. Something like that. And try to use that hot to your advantage to distract you. Then you can switch off and go into cold to kind of jolt you, jolt your system into what you need to do. You can use these physical techniques to help you, basically. Obviously, with severe chronic pain, they're not going to make it go away, but they can help your brain to handle and cope with it better. Right? And they can help you with things like depression, because the same chemicals that are implicated in pain often are related to depression. Right? So that's another thing. So we talked about distraction, we talked about color therapy, we talked about using hot and cold as a therapeutic technique, self-soothing, and massage, petting yourself in the area that hurts. That's another thing that people did or do in stone therapy, is actually rubbing the stone that's wrapped in something so you don't hurt over an area, right? And that that's that and the whole field of massage are based on the principles of improving blood flow into the area, right? So there's things you can do to self-soothe, basically, and those are good things to help also with getting your brain right, so that you can, because sometimes you're too stressed out to think through some of the CBT and DBT principles we've done on this channel, right? Sometimes you're too stressed out to do that, and so one way to deal with that pain is to kind of bring yourself back into some of these other techniques. Another technique for severe pain we talked about in the video about techniques used by concentration camp victims and POWs, and that's like basically kind of self-dissociating, going into a kind of little fugue about where you're imagining something else, and so your brain is basically somewhere else, right? That is another technique that you can use, like with the one POW that I mentioned, that I think he was a torture victim. What I mentioned is he would go into his brain and think about and imagine himself, and not just imagine himself, but like be there, be with his daughter in the future, walking her down the aisle, or like Viktor Frankl imagining his wife when he was in the concentration camp, where like you're not just imagining, like you are there, you have made it real in your brain, and you are faded off into that place. It brings me to memory, actually, reading accounts from persecution victims. So people, so while in Western nations, or like in like the United States, certain belief systems are very widely accepted. In much of the world, actually, you can be killed for having, certain faith systems. A very strong example is people being arrested or killed for being Christian in China, or for and it's a huge, it's a huge human rights issue, especially for women, and then women in predominantly Middle Eastern countries also will sometimes have reactive, it's called like reactive rape in response to them choosing a different faith than the faith that's predominant in those areas, right? So these horrible things happening to these people. And I remember studying one account, and it's interesting because the guy, this was actually an Eastern European account from a while ago. So this isn't something that I follow. I follow a lot of human trafficking, and I follow a lot of human rights stuff, because it's stuff that we're actively involved in, financially trying to put an end to, and trying to support, compassion and freedom, and not human rights abuses throughout the world. That's part of what my Patreon goes to. Is I help fund anti-persecution and anti-human trafficking organizations. That's something that we do, and so as part of keeping my ear to the ground on that, I've also studied trends in persecution in the last 50, 60 years, because more people have been killed worldwide for their faith in the past 70 or so years than were killed in the several hundred leading up to that. Part of that is just because of the world population. You look back to the Inquisition, it was 12,000 people total, and we talk about it all the time in our history lessons. But we have at least that many in 4 or 5 years, right, of recent time. And of course, it's over 60 years. That's many, many more times that many people. So, I think we tend to have a lot of privilege, some of us, where we can, close our ears and think that. I might leave it at that. It's going to get a little discouraging to talk about, but it's very easy to be so in your own suffering or so in your own experience that you don't see the world around you, and that people like there's more slavery now than there ever has been in the world before, ever, just because our area of the world has a different kind of slavery than it used to have. We hide that, or we don't think about that, but again, part of this is population increase, so more numbers of people versus proportionally proportional population shifts. But for the sake of thinking about human rights, like one individual person is a tragedy that has been trafficked or killed because of their beliefs or all this other stuff, right? So that's why I think it is important to think in numbers, not just proportionally, because these are numbers, each individual human life. So anyway, studying suffering is something that I do. And because I'm involved with these kind of organizations, and in those studies, I remember actually reading cases where people who were being tortured for their faith, they would have this like ephemeral experience of their Messiah, right? Oh, sorry, whacking you. Sorry about that. So there is also a psychological basis to that, not just on their, and I'm not trying to explain away anyone's faith or anything like that, but the psychological basis of that experience, that thing, is similar to like the Jewish concentration camp. The psychiatrist Viktor Frankl was in a concentration camp. What he experienced and observed with the POWs are observing these same, people are being persecuted for their faith. During moments of intense torture, would have these same either release, and again, theorizing, I wasn't there, I didn't take any blood samples, but you're theorizing that you're probably either triggering a release of those enkephalins, or just that in conjunction with some of these imaging states that they put themselves into. And it doesn't mean it's any less real. I'm not here. I wasn't there. I'm not here to say God did or didn't talk to them in those moments. But just like when I talk to you, you have a biological response. There is little hairs moving in your ear, in your inner ear. That doesn't make my talking to you any less real. That's just the how of what it is. Again, I wasn't there. I don't know if God talked to people or didn't talk to people. I have my own beliefs about that. But there is also a psychological trick there that you can harness onto. Wow, it took me a while to get back there. I just went on this long tangent about suffering and everything else like that. I feel like a dum-dum. Okay, we're gonna end here while I'm feeling like a dum-dum. And I hope that this is helpful and not stupid. But guided imagery is another one that you should try for your moments of severe depression, severe pain. Get yourself into that flow and basically shock yourself into that I'm not here mentality. You can use that. Obviously, you don't want to. So I was talking to a pain psychologist yesterday about some of his POW people, and there's a issue where we're transitioning back out of those traumatic states. It was difficult that they were living in, right? The challenge was how to get out of that like emergency coping brain state, right? And this is where you're talking about PTSD and stuff like that. But you know how to use. I think I said what I needed to say. People get stuck in these traumatic experiences, but that's a different issue altogether. We've talked about PTSD before, we can talk about it again. But for coping with pain and coping with depression, this is a thing you can try. Wow, I really am undermining myself today, just re-saying things or saying things. One last one that I wanted to mention is self-coaching, and this is when you basically ask yourself, who was the most, who is somebody that you really look up to, and ask yourself what you would like to do to be more like them is one thing you can ask. But a technique that you can use for self-comforting is imagining or is to take the things that you think they would say to you if they were your coach, if they were your personal coach. What things would they say to you in your moment of distress? So that's something you can write down and think about. People have used this all the way for visualization, like the guy who wrote Think and Grow Rich, who is not a scientist by any means, but it's interesting to read about his inner life and read about how he would pretend he was talking to Abraham Lincoln, and Abraham Lincoln was telling him stuff. And he became very successful doing that. Well, it actually makes sense, right? Because you are self-teaching yourself principles that are going to be useful. So, and then also you're self-soothing, and you're also kind of rewiring some of the cognitive spaces up in here. There's a lot of reasons why that would work. You don't have to talk to imaginary Abraham Lincoln. Obviously, please don't go crazy. Please don't be delusional. I think you are talking to Abraham Lincoln. These are games that you're playing with your brain, just like a little kid playing pretend. As adults, you forget to visualize success, which is the last technique. Visualize. Can you picture yourself happy? Can you picture yourself in that other, at your goal, right? That's really hard, and people who are depressed often we cannot. So if we cannot picture that, picturing an intermediate, picturing, the very next goal. If we can't picture a long-term goal, we can't picture being happy, at least maybe we can picture, imagine ourselves somewhere else. So this is why sci-fi imagining works better for me than straight visualization in my real world, because I have trouble imagining things turning out in real life. But science fiction is not real. So it's so out there. My brain accepts it. My brain suspended disbelief, and then I can imagine through scenarios working out certain ways, right? So do that. Trick your brain. If you unfortunately like me can't visualize all the way healthy like you need to. You can't visualize success. You can't visualize happiness. If you can't use that technique, trick yourself and use a different version of that technique, right? To think through and imagine yourself through to the happier place. And similarly with the coaching, imagine it doesn't have to be a real person, but imagine this positive talk from somebody else. And again, and obviously, please don't go crazy and start talking to the walls and thinking that they're actually talking to you. Please, use your intelligence and stay grounded in reality. It kind of freaks me out when people start out doing mindfulness exercises and end up talking to, like, things. So, obviously, stay grounded in what is real, but you're not going to go crazy imagining. Okay, Anna Karenina is my hero. I don't know why that name has a lot of N's, and I wanted to say Anna Karenina is my hero. What would Anna Karenina say to me this time? Okay, well, what if I said this? Well, then what does she say? And then what would I say this? And what does she say? And have your conversation with Abraham Lincoln. Have your conversation with your person in your brain, and help yourself through the distressing moment. My friend Jason Todd says XYZ thing. Jason Todd is not real, right? My friend says XYZ thing to me, and then I respond this way, right? How are you responding, right? And that helps. So I think that's 7 techniques we've talked through for you to try, and I hope that you find them helpful. I wanted to actually try some of them together, but actually the only one that would make, I think, a good session together is color therapy. Because some of these techniques that I'm incorporating in reverse in videos when I spend time with you, right? I brought up Jason Todd for a reason. Trying to put these healthier psychological thinking patterns in your brain from the outside. Wow. I really, really must go. I am getting tired, and I know you are getting tired. And I think you're probably sleepy by now, right? I'm sorry I get all over the place. Yeah. I hope you're not too annoyed with me. I really, really want to be helpful to you. And, yeah. If you're still here at 53 minutes and 41 seconds, let me know. Yeah, because it's about this time in the conversation where I start to feel like, what is the point of me? Why am I doing this? This is stupid. I'm in this, like, if we're in the hoodie looking silly and talking stuff that it's silly because you get the false imposter syndrome. I have a medical degree. I have all these experiences I've gone through. I have all this stuff. But I definitely get the false imposter syndrome. And when people like me, I think I must have fooled them. That's what I say, like, you really, because people do eventually get, I don't know, it's just been my experience. People are disappointed because I'm a very exciting and strange person, and so they put this idea of what I am in their head, and then when they actually meet me, really like the real me, they tend to be disappointed. And that's happened many, many, many times in my life, where initially people think I'm fabulous, and then they kind of get to know me and my flaws and stuff, and I have serious flaws. Like, it's just, it isn't Dr. Jekyll and Mr. Hyde over here, but there's definitely a dark side to me, and they are not pleased anymore. And sometimes I'm very weird also, and I know I'm weird. I know that I tangent all over the place. psyche just kind of spinning out of control isn't just, I don't, somebody in the comments got, like, made fun of me because they were like, what you did, you know, you only did this much of the ear exam, and then you spent an hour just talking to us, what, because you were lonely? Like kind of like loserific, like, what a loser you are. So I get, and I am at a point in my life where I don't have the ability that I once did to shut out negativity and to say, I don't care, F you, because of some of because of the stuff that I talk about in the video about the comedy video, the ASMR stand-up comedy video, where we talk about the Korean graveyards and all the like weird scandals and everything else like that. After that stuff happened, and seeing that I couldn't get the justice that my survivors needed, and feeling like there's been a big self-confidence blow. So around this time in a video, I get to where I'm like, yeah, maybe that person is right. Like, what am I doing? I'm just sitting here, what, because I'm lonely, what a loser, blah, blah, all this negative self-talk, right? So you gotta stop that negative self-talk with answers about what is true, what is real. Because there is negative self-talk that you have to learn from, right? You don't want to be narcissistic, which is another thing that they called me. You don't want to forget, you know, to improve yourself. But there's a difference, and something actually a wise pastor said years ago that I thought was interesting. Like, there is a difference between what he called the Holy Spirit convicting you of a, like, that'll be specific, that'll tell you here's a specific thing you can do better, and it will not cut you down, versus, like, just the enemy, right? Because this is within a religious framework. The enemy will just tell you, you know, you're bad, and just be all negative at you, and there's really no way out. So a lot of the, like, negative self-talk is difficult because a very clever, that's probably done. A very clever negative brain will come up with a lot of negative. It'll be just hard to fight back against the negative self-talk, and that's why you gotta encourage each other. You gotta, you know, help. You need someone outside your ear to help you out. So, I mean, that's why if you don't have a therapist, betterhelp.com/Dr. Jen, that's a good option for you. Because, you know, then you have somebody online that you can talk to regularly who can kind of help you from outside perspective. But if you can't do that, you know, if you have a close friend, a wise older grandma, a rabbi, a pastor, like, if you have somebody with whom you can, you know, confide, and somebody who can help knock you out of the lies, basically, into reality. And you need to be careful, because all those people can mess up, right? Your pastor or your therapist can also sometimes be enabling, and they can support your negative self-talk, not the negative stuff, but they can help you not improve yourself, because they say, because it's you know, a lot of fluff, right? People don't get down and dirty to the real techniques. It depends on people's dreams. Or, you know, I have had therapists in the past that were really bad, and that would let me talk myself into a spiral because they didn't know how to interrupt me and ask, is that true? And then on the other hand, people who would always be like, is that true, is that true, is that true? And so I'm like doubting myself, like, even about stuff that I do need to improve, or stuff that did, you know. It's tough out there. That's all I'm saying. It's tough out there to be somebody with mental illness, and it's very tough once your confidence has all been sapped. And so all of these techniques are techniques to kind of help you as you're bringing all that back, because in the end, yes, all these resources and other people can be helpful to you, but in the end, it is you by yourself who has to fight the fight. You are the one who in the end are going to live or die. You are the one in the end who's going to cut or not cut. You are the one in the end who's going to, you know, rise like a phoenix or fall like a wet bird, seagull into the depths of the ocean and get eaten by little fishes. Okay, that's you. some ways I think that's encouraging and an helpline. You are a warrior, and I believe in you, and I appreciate you for believing in me when I don't believe in me. And thanks for spending some time with me, warrior. Yeah, I think so. I really do love you guys. And it's easy to be like, I love you, man, or I love you, girl. Like, it's that the words I love you are so uncomfortable that we need to water them down all the time. But what is love but wanting the best for somebody else, right? I want the best for you, and I hope that this has helped you to find some of the best and